Well, let's begin with the duties that you have. Obviously, we are seeing things in the media and have our preconceived notions on what nurses are doing right now. But what specifically are you, I guess, even what floor, if you will, are you working on during the pandemic times?
Right. So I work on the cardiac intermediate medical unit. Um, every day recently has looked a little bit different, but I usually have about 6 patients. It just depends on our census at the moment. Most of these patients are chest pain, cardiac dysrhythmias, a day or two out from open heart surgeries and lobectomies, congestive heart failure. But many of these patients, require some type of test or procedure or surgery. And, the hospital and hospitals nationwide have been limiting those elective procedures. And now that's just emergent. So our census has kind of risen and fallen as we've just been getting patients. They're just trying to limit that exposure to COVID-19. It seems as though every day something changes with our PPE and our policies. You get one mask or two masks or brown bag or that kind of thing. And currently some of our intermediate nurses like myself are going through a quick ICU training. This is to help take on those lower acuity patients so that there's ample room and equipment and care and nurses in the actual ICU. We've had units merged together. I know the neuro unit has a hallway on our unit now because that unit will be used as a COVID unit or another ICU if need be. But, our ICU and ED nurses, our docs and our infectious disease team, they've really been just so brave and doing the best they possibly can, making sure that everybody's safe, but most importantly, the patient, making sure they're getting the care they deserve and need. And overall, I think I'm just pretty proud of the way that Centra's handled it all, and our level of preparedness. And, especially with keeping the community updated with town halls and forums, trying to keep their stress level to a minimum.
I think one thing that is interesting in your situation, and really anyone that graduated with you or even the year before, is that you're so young into this process and into this career path. How in the world can you be prepared so quickly for something that is unprecedented, something that no one that we know that's alive has ever had to deal with before?
Yeah, it's pretty nerve-wracking. I mean, you're in school for 4 years and they don't teach you any of this kind of stuff, or they teach you the certain ways you need to wear PPE and the guidelines that you're supposed to use it one time and throw it away. And unfortunately, just in these cases, we have so many patients. We're trying to, limit how many gowns and how many masks we use because we don't want to go through all of them and then kind of be stuck with nothing in the end. So it definitely is nerve-wracking, but at the same time, it's, there's parts of me that I wish that maybe I was frontline on the actual COVID unit because at least I know what I'm getting into, but also I can actually help and say, I'm putting all my efforts and my passion into helping these people during this time. But, we have great teamwork and just great people at the hospital that are really just there for one another.
Let me ask you a question that is somewhat, in that national mindset, and that, there's a lot of reports about there not being enough. Then there are reports about places that do have enough. What does that look like in the Lynchburg area? Where do we stand in the conversation of ventilators and N95 masks?
So currently N95 masks are being given to those truly on the front lines, our physicians and our ED nurses, as well as, respiratory therapy needs to be all gowned up and everything like that. And our ICU units that are COVID designated units, we have just transformed 2 units into, a secondary ICU COVID unit. So we have extra room there for ventilators. So, we're not full up on patients yet, but, unfortunately we might be getting there shortly. But I think that Centra's done a great job in trying to prepare and moving people around and moving units around just to have as many beds and ventilators and equipment as needed.
Can you speak specifically to the Lynchburg nursing program and really what you believe they did that maybe you didn't even realize they were doing that has prepared you to be so ready for something that really no one seemed to be prepared for?
Yeah. I think right now what's most important is to just be flexible and have an open mind during all of this. I mean, it can be so frustrating when every time you go into work, something changes with wearing the mask or whatever. But I think the nursing program, as well as the soccer program, have really instilled this whole idea of being comfortable in the uncomfortable. You know, taught me about facing adversity is really truly the only thing that's going to make you a better person in the outcome, and make you stronger in the end. Especially having a positive attitude and maintaining a brave face, as well as kind of like a sense of calmness and level of calmness to yourself, I think really helps, especially as a leader. If I'm stressed at work, my triad, my LPN and my CNA, that team that I'm working with that day can probably feel that stress and that negativity can radiate. And then, that affects our patient care. And it's the same as being on the field too. If you're being negative or under a lot of pressure, you or your teammates can't perform to the best of their abilities. I think that I'm very grateful for my time at Lynchburg, especially being a student athlete, because, many of my coworkers have thanked me for being so just dependable and a true team player and just kind of doing everything with that level of passion that comes from being a student athlete.
Speaking to those that aren't quite there yet, so thinking about current nursing students, current student athletes, some of which are having to think about the real world earlier than they expected because
Right.
of all of this, what do you think that they should know? What can you tell them that maybe you're using every day to calm other people down or to change people's perspectives into a positive way? What are some of those messages that you can give to the Hornets around us that are in some really confusing and troubling times?
Yeah, I mean, I think at the end of the day, it kind of just comes down to being human. Understanding that this is such a trying time for everyone, no matter your occupation, and even if you have a job, some people don't have a job, unfortunately. And the students and teachers that are trying to figure out how to learn from home and how to grade papers and all of these things. My heart goes out to all of my student athletes and my seniors, whether they played a sport or not. But I think mainly just kind of giving yourself some grace during this time period, knowing that this too shall pass, but what are you going to learn from it? Personally, for me, I'm such a type A personality that needs to be doing something 24/7, needs to be productive and have a routine. And this has kind of shown me, take a breath, slow down. It's okay to slow down, but kind of just being open to letting things change you and being open to going with the flow for once, maybe, and knowing that there is a reason at the end of this.
Yeah, maybe is the key word there. Maybe you slow down, maybe not. Well, speaking of the slowdown, we know this is, or I know this seems to be a slower day for you. So I'll let you go enjoy the slowness of today and really just thank you from the bottom of my heart and everyone that is watching. I know they're appreciative of what you're doing and your colleagues are doing. As someone who lives here in Lynchburg, I'm especially thankful for you because you and your colleagues are directly, helping me and helping others that are still in the Lynchburg area. So thanks for that. Thanks for your time and really just keep crushing it. I'm so impressed.
Thank you. I really appreciate it. Remember to wash your hands. Stay safe.